gracious social responsibility investment by John and Shirley Porter of the Porter Foundation and Peter McMillan and David Holbrook of the Vimy Foundation, Care for Peace purchased a mobile health van that commenced operations on September 1st of this year in the Chakfu Township, where the Care for Peace prototype mini medical center will be built. This last November, Ulachi and I flew from California to Yangon and then flew to Chakfu with our Myanmar partners, Dr. U Tan Sein, President of the People's Health Foundation, Ula Mantain, President of the Rakhine Talai Association, and Dr. U Tin Tun, Director of Disease Control of the National Ministry of Health. We met our Chakfu partner, Dr. U Shui Tain, Chakfu District Medical Officer, and then we all climbed on board the van. We drove through some of the most beautiful countryside in the world and stopped in the Piang Sait Khe village, where a thatched roof home had been converted into a temporary clinic earlier in the day. When our visiting team arrived, there were already 50 people, mostly elderly women, women of childbearing age, infants and children, waiting to be seen by the medical doctor. The mobile health nurse had already set up a table where she registered each patient, wrote down their names on both a log and a patient-carried record. The medical doctor had already spread a blanket on a raised wooden platform where he began to see and examine every patient, prescribe medications and treatments, and complete the patient record. During the steady flow of patients, everything was written down. After Dr. Kokofio completed his examination of a patient, he documented his diagnosis along with any instructions, treatments, and prescriptions in the patient-carried record. The nurse then filled the prescription and wrote all of Dr. Kokofio's script in the permanent mobile health van log. The van's medical team has also been collecting vital patient health data so that we can determine what healthcare services are needed for the prototype mini medical center that will be built by Care for Peace to meet all of the preventive health, emergency treatment, birthing, and medical care needs of the surrounding Chakfu villages. The mobile health van medical doctor and nurse have been providing preventive health care, women's and children's health care, and basic medical care to 1,200 villagers to date. Our time in Piang Sait Khe village was invaluable. We realized that the original question, if we build it, will they come, is no longer a question. If peace could be measured by the calm look on the faces of the people who received health care by the mobile health van staff, and if the concept that there is a connection between the health care provided and the peace expressed in their faces, then that's all the proof of concept I need to persevere and to bring life to our Care for Peace vision of building enough mini medical centers that will serve the people who live in rural Myanmar.